According to the United Nations, more than 40% of women around the world cannot make decisions on sexual and reproductive health and reproductive rights. Reproductive health is a very delicate aspect of a woman's life, and quality abortion care is a critical part of the universal right to health and essential to protect the health of women and girls. Unsafe abortion remains one of the 5 leading causes of maternal mortality, despite the fact that it is mostly preventable. Nigeria's abortion laws make it one of the most restrictive countries regarding abortion. Many Nigerian women seek unsafe abortion methods to avoid criminal and social penalties. According to research done by the Guttmacher Institute, an estimated 456,000 unsafe abortions are done in Nigeria every year. While some people seek to undergo the procedure because they don't want to become parents, others choose to terminate because continuing a pregnancy could put their life in danger. Joining us in the studio is consultant obstetrician and gynecologist, Dr. Kehinde Okunade. Good morning.
Good morning. Yeah, thank you for having me.
And via Zoom is legal consultant, senior lecturer at UNILAG, Dr. Akinola Akintayo. Good morning. Thank you for joining us.
Thank you very much. Good morning, ma'am. Good morning, Nigerians.
Right. Let's begin in the studio. At one point, would a woman who is a matured age, that she's married or not, decide to abort a pregnancy?
Okay, thank you very much for that question. The most important thing is that just a follow-up to that question is that it is very important for us to realize that up to 73 million abortions occur every year worldwide. Okay. And of course, out of this 73 million abortion, more than half of them are actually unsafe. And being unsafe means that a woman, because of the fact that she doesn't have access to safe, effective, and timely option to be able to access care, they'll be able to give her the option to decide that she wants to abort that pregnancy because probably for some reason or the other, probably because she's not ready to have the pregnancy, it was unintended, or probably because she doesn't have the means or the finance to be able to take care of that pregnancy. So those are the options that can make her, of course, decide that, okay, let me go ahead and, of course, terminate this pregnancy. But one very fundamental issue that we need to understand is that most of these pregnancies that are terminated actually not done in a very safe atmosphere, meaning that they don't get it terminated where there is experts that have the skill. And of course, not in an atmosphere, in an environment that have the minimum medical standard, meaning that there are some things that need to be in place for that abortion to be carried out. But most times, because of the stigma associated with the fact that a woman wants to decide to terminate that pregnancy, they go to places where they meet quack, who can use different methods. Sometimes they use stick. So, yes, they put stick in the womb. Sometimes they put rubbers, they put iron, which are not things that are recommended to be used to terminate such pregnancy. And that is
that could harm the woman's uterus as it is.
Yes, and that is the kind of gory picture that we deal with every day. Meaning that when such women come, you see that their womb is perforated. Sometimes you see some of their intestine coming out through their vagina because somebody had put something in the vagina to draw out, trying to terminate the pregnancy, but in the process had been able to, hang on to the bowel, to the intestine, and bring it out through the vagina. And of course, what we are going to see is that the intestine will become gangrenous, and of course, that woman definitely is going to die from such a complication.
That's a lot.
To you, Dr. Akintayo, let's talk about some of the legal restrictions women face as regards abortion, some of the policies that we have in place as regards abortions in Lagos especially. Talk to us about that.
Okay, so, until 2011, when the Lagos State government enacted a new criminal code where they brought about this very significant reform in the area of reproductive health. Lagos, before then, has generally followed the other laws existing in Nigeria, in that abortion is not permitted under the laws of Nigeria except to save the life of the woman or to save the life of the fetus. So basically to protect the life and limb of the woman. So, but in 2011, Section 203 of the Criminal Code Law of Lagos State brought about a significant shift in that law, in that in addition to the life of the woman or the life of the mother's exception that is contained both under the Criminal Code Act at the federal level and the Penal Code applicable in the northern part of Nigeria, the Criminal Code Law of Lagos State added the physical health of the woman also to the life exception that is contained in the other laws. So in Lagos State at present, a woman can seek abortion and can legally abort a pregnancy if her life is in danger or is going to significantly affect her health. And then I think recently, just before the election, the Lagos State Ministry of Health also issued a guideline to clarify the provisions of Section 203 of the Lagos State Criminal Code Law in order to set out those conditions health-wise, those medical conditions that will come within the ambit of Section 203 of the Lagos State Law. And that guideline contains plethora, robust health indications that will qualify cancer, hypertension, a whole lot of medical conditions that will qualify were set out in that guideline. But unfortunately, just before the 2023 election, it got out to the public that the Lagos State government has issued a guideline, to operationalize Section 203 of that criminal law. There was an uproar from conservative section of the society saying that the Lagos States want to start to kill babies, to kill human beings, to authorize women to kill unborn children and all that and all that. As a result of that uproar and, election was approaching, they had to withdraw the guideline. So the guideline has been withdrawn. But at present in Lagos State, there are two exceptions under which a woman can seek abortion in Lagos State specifically, and that is to save the life of the woman if the life of the woman is in danger or if her health is going to be negatively impacted or affected. So that is the position of the law as it is today.
All right. So if I understood you clearly, a woman cannot seek abortion if it is not a risk to the mother or the child. That's what you're saying.
Exactly. That is what I'm saying.
Does the psychological factor, does it come into play here? Looking at cases of rape where victims do not want to, keep this pregnancy, are they bound by the law to keep it, despite some of the circumstances surrounding them?
Thank you very much for that question. I mean, that is one of the controversial issues surrounding the law on abortion in Nigeria generally and Lagos State specifically. Will psychological reasons or trauma or, things like that come within the ambit of the right to life exception or the physical health exception, particularly in Lagos State? But on the black and white interpretation of the law as it is, those rape, whether a woman has been raped or for other psychological reasons is not capable of continuing to carry the pregnancy, is not an excuse or a condition that will come within the ambit of the exception that has been provided under the law. Although there are arguments to find ways to push the boundaries of that change. But as it is, things like rape, incest, and stuff like that are not within the ambit of the exception under the current regime of the law.
All right, let's bring the conversation into the studio. Because of the sensitivity of this conversation, our choice of words, we have to tone it down a bit and to also strike some balance for our viewers that we are not encouraging people to go for abortion as it is, but looking at the conditions surrounding the situation. For instance, she mentioned rape, the state of the mother carrying the child might just be a high-risk pregnancy as it is, and all of that are the reasons why we're having this conversation, basically, because you know how we are in this part of the world, religious, and then we're also very conservative, and then we're also looking at the myths surrounding these issues. Children are blessings from God. Why would you want to kill them as it is? You should, look at how you can balance and just have access to quality health care, which is also another aspect that I'd like for us to talk about. Mothers, when we look at them, they're accessing quality health care that helps them through the 9-month period. Will they necessarily need to go through the process of seeking for unsafe processes of aborting these babies as it is? Because that's also another aspect, that some persons may not just be taking care of these babies as they should because they are not accessing quality health care, maternal care as it is, and then find themselves seeking solutions that may not help them at the end of the day.
Yeah, thank you. Thank you for that. Yeah, and let me also put it out there that because being here, I also represent a body of doctors, gynecologists in Nigeria, and we don't encourage people to, of course, have abortion. Basically, we actually advocate more for the use of, contraception in different forms for family planning, especially in family, and all that. But, of course, just like Dr. Akitayo said, there are some pregnancy that will result from very unusual circumstances, for instance, rape, incest. And it's very difficult for you to, because of the stigma associated with this, and of course the lifelong consequences of such such pregnancy, very difficult for you to say, okay, maybe a girl or a woman that is raped should keep such pregnancy because of the lifelong psychological effect. But more importantly, it is also very important because as obstetricians and gynecologists, we know there are so many conditions that can have deleterious effect on a woman when she gets pregnant.
Right.
Yeah, and such conditions, when a woman have them, of course, because it's a greater burden on the country if a woman lost her life because she's carrying a pregnancy that will pose danger to her. So basically, when such women come, and of course, when we look at the circumstances and of course discuss among ourselves, or feel such pregnancy will pose danger to that woman, then of course the option to terminate that pregnancy can be offered. And these are the things that are contained in the guideline that Dr. Akitayo was referring to. For instance, if a woman has very severe cardiac condition, renal condition, liver condition, she may even have condition, basically, that will, of course, sometimes when she's carrying a pregnancy, a baby that is congenitally malformed, meaning that baby is, when you look at the baby, of course,
it's not growing in the way it should. Yeah.
There is abnormality. You can't tell because of the psychological effect on that woman and the family. You cannot, in good conscience, tell that woman to continue to carry that pregnancy. But ordinarily, we are not going to say maybe. Sometimes, of course, the first option is to offer that woman the option of saying, okay, fine, this pregnancy has occurred. When they come to us and we say, okay, you have the option to keep this pregnancy. You have the option to give this baby out for adoption. Yes. But when that pregnancy poses danger to the life of that woman, of course, that will not be our part of discussion. The part of discussion is to offer the woman the best and the most effective method to terminate that pregnancy so that she can live her life and be able to take care of children that she may have had prior to that particular pregnancy. So those are the...
And like she mentioned earlier, this part of the world, we are conservative, we are religious, cultural to an extent. How much have we grown as regards the awareness of women, as regards women's reproductive health,
Right.
assessing these services, family planning, the use of contraceptions, and all of these services. We still have women who say no to family planning because of some cultural issues, conservative issues.
And to that, ours is also a patriarchal society where the woman cannot make decisions on her own. The man has to support whatever decisions she's making. How are we able to navigate all of these bottlenecks? And how far have we come, basically?
Yes. As a body of doctors, gynecologists and obstetricians, we're also very sensitive to that particular issue because we are also members of this society.
Yeah.
So we understand where people come from. And of course, we have our members also coming from different religious sects and different faiths. And of course, but usually what we do is that when such issue arise, of course, we can offer different options that are available. Sometimes some people, their family planning option that they are going to accept may not necessarily be you giving them drugs. It may not necessarily be you inserting some kind of device into their body. It may just be the fact that you can counsel them about how they can effectively, be able to, when they're having sex, so that they can interrupt the sex.
Yeah, choice of words.
Yes. Oh, sorry.
Yeah.
Oh, okay. So they can interrupt, when they're having,
Intercourse.
intercourse. Yeah, that's a good one. So then, of course, there are also other options that do not require the use of drugs, which we provide when they come to us for counseling and, of course, for provision of services.
Right.
Yeah.
Okay, let me come to you now, Dr. Akintayo, as it is with regards to this matter. There has been calls for reforms to these laws for accessibility and for safety of women's health and rights as it is. And if we are talking about reforms, what are we looking at?
Okay, if we are talking about reforms, we are looking at changing the existing law, to be more permissive, to create more exceptions that will benefit the women and incorporate things like psychological states and competence and capacity to carry pregnancy to term. Also, other circumstances and conditions that implicate the dignity and equality of the woman. Because generally speaking, most countries in the world actually follow the public health approach to abortion, which is that abortion is only permitted when the life or the limb of the woman is in jeopardy. But there are other situations that can actually affect the capacity or the competence of a woman to carry a pregnancy to term. It could be socioeconomic, serious socioeconomic condition. Dr. Okade mentioned there about if one of the persons in the house, if a woman doesn't have the means, to take care of the children and all that. And if it's a very serious situation, those are exceptions that are allowed elsewhere. So if we are talking about reform, what we are looking at is beyond the health and the life of the woman. Are there other conditions that should qualify as exceptions and permission for a woman to terminate a pregnancy? Psychological, mental, beyond the health prism, probably serious socioeconomic condition, other cases of or conditions like gang rape, incest, and all that are allowed under more developed jurisdictions. So, if we are talking about reform, is changing the law to allow those kind of factors to count also as grounds upon which a woman can seek the termination of a pregnancy. But like you said, because Nigeria, abortion is a very emotive and controversial subject. And that is why the focus has been on, how is it affecting the public health generally when you talk about maternal mortality, when you talk about
right. Dr. Akintayo, quickly, because of our time, I want to quickly ask this question. There are some imbalances with regards to the application or implementation of the law. There are those who say in the North, this law is not applicable, so to speak, where mothers have to resort to finding other alternatives to addressing these issues. What kinds of engagement are we hoping to see in the coming days with regards to this, especially from legal practitioners and doctors like yours, such that women who find themselves under this category of perhaps a pregnancy that poses a risk can access legally safe abortion as it is?
Well, one very effective mechanism that is being explored by different civil society and NGO and even Sogon, because I know Dr. very well and Sogon, is public interest litigation to expand the boundaries of the law. That is, you take a matter which a case study and you ask the court to interpret the law and say, okay, in the light of existing exception, life of the woman or health of the woman, as the case may be in Lagos State, should psychological conditions not also qualify? And you proffer arguments, you proffer illustrations and examples from other places, and hopefully the court accepts that argument. Of course, that will expand the scope of the law. Another very important mechanism also that is being deployed in an ongoing basis, especially in the North, is enlightenment. People need to be enlightened as to what is even there, because like you said, most women are not even aware of the scope of what is available.
Right. Talk
less of pushing the frontiers. So enlightenment and education is really also very, very important. All right. To take these things forward.
All right. We have to leave this conversation here now because our time is up. We must thank you, Dr. Akinola Akintayo, legal consultant, senior lecturer, UNILAG, as well as in the studio here, consultant obstetrician and gynecologist, Dr. Kehinde Ukwade, for your time as well. Thank you.